Hi guys, Dr. Hasib Ahmed here, Medical Director of Live Active Aesthetics, and I am going to be talking about the Halo Laser. So not a lot of med spas are going to have Halo Laser. At Live Active Aesthetics, we're a boutique med spa, and we do evidence-based practice. So as a physician, it's very important for me to assure that all of the services that we provide are evidence-based. So we don't provide this huge laundry list of services. We pick certain ones that are the best. And then we tell our patients, hey, this is the treatment plan. This is what we need to do. Same thing with skin products. So it's so confusing out there. And my hope is through these videos, please like and subscribe to us. So it helps us quite a bit and comment. And because your questions and your ideas help me to make sure that I fill in any knowledge gaps when it comes to aesthetics. So I'm going to talk about Halo today, which is a hybrid laser. And so people talk about hybrid laser, ablative and non-ablative. I'm going to try to keep it very simple for you. Halo laser is the first of its kind. It's a Cyton laser. It's fantastic. You only need 1 to 2 treatments a year. You can do different areas like your face, your neck, your arms, your chest, and your legs. You can do different areas as well. So it's not just the face, but what it's doing is it has an ablative approach where it's going to slough off all that dead skin and stimulate collagen so that new skin can come forward. It's also going to eliminate those deep scars. It penetrates really deep into the skin to make long-lasting changes. That's the other piece, is that it's long-lasting benefits. This is not something like where BBL, broadband light, which is not a laser, it's a broadband light therapy. It's going to go deep into the skin, but not as deep as the Halo wavelengths, but you have to do 3 to 5 treatments with the BBL. So Halo, 1 to 2 treatments, sometimes 3. Skin types 1, 2, 3, and 4, I would also say. Now, Cyton's website will say 1 and 2 only. However, my wife has a skin type 4. She got the Halo done. There's a way to do it. There's adjustments in the settings that we can do. People with my skin type, I'm kind of a type 4, 5-ish. So again, that means on the cooling. So as we do the laser, we just have to cool the proper ways, adjust the wavelengths when we do it so that we don't burn. So this is why a physician-led practice makes the most sense. That's why what you should do is follow get your services at a physician-led practice, because we're always watching and we can adjust. And if God forbid you do have some complications, a burn or something, we're ready to treat you, right? So that's very important. So Halo laser, again, the downtime is about, I'm going to say 5 to 7 days. I mean, people say 5 days, but I would say 5 to 7 days. You'll see changes that happen after the Halo procedure. There'll be a little bit of swelling. So sometimes I use prednisone, Medrol dose pack, something like that. But the swelling that happens after a Halo is actually good because it's good inflammation. Sometimes inflammation is good in our body, kind of like viruses. When people have a viral infection, we always say, don't use antibiotics. Well, because it's not a bacteria, it's a virus. But also because your body, when it fights a virus, it gets actually stronger. It recruits those armies, soldiers to fight the infection. It starts to develop memory of how to fight infections. So inflammation brings all the proteins in to heal the tissues. And so you don't want to control it too much, but you definitely want to help with quality of life, right? So if your eyes are swelling, we definitely want to give some prednisone. I've also read some folks who do topical steroids like triamcinolone or budesonide or clobetasol. These are higher dose steroids, so hydrocortisone, triamcinolone, clobetasol, the strength increases. So I try to get away with hydrocortisone or triamcinolone, just low dose, because steroids can thin the skin as well. I mean, anything long-term is not a good idea. And then you're not working out. You can't work out or sweat excessively for that 7-day period. And so you want to really do the post-care treatment. We give you creams and lotions to kind of help, peptides to help heal. Elastin has nectar. There's also a Clinical Plus that we've been working with as well that has a peptide collagen stimulation and a healing lotion. Those kinds of things. So again, we'll walk you through all of that for post-care. And then sunscreen, of course. Sunscreen is very important. So check out a Halo laser. You really should look into it. It's fantastic. Not all med spas have it, and for good reason, because it is a very a robust laser, and you got to know what you're doing, and you got to have the right place to get it. So Live Active Aesthetics is the place to be. It's a boutique med spa. We're evidence-based. We're not a big laundry list of stuff. We only do a few procedures, but we do it the best. So check us out. Thanks for watching. Please subscribe and write comments, and happy to educate you.